Welcome back to WoundCasters by Wound Care Today. I'm your host, Felix Boecker, and today we're talking about a mantra from the battlefield that holds a powerful lesson for us in the clinic. Run to the sound of the guns. I recently read The Wisdom of the Bullfrog by Admiral William McRaven. Now, you may have seen his University of Texas commencement address in 2014, where he explains the power of making your bed every morning. In this book, he covers 18 important leadership lessons he learned in his time in the Navy SEALs. And upon reading this book, I felt the principles he talks about apply to us in chronic wound care as well. Now, of course, I don't mean this literally. I sincerely hope there are no guns involved in your practice of chronic wound care. In a military context, however, this principle means that when you hear the sound of the most intense fighting, you don't retreat. You run towards it to support your teammates and engage the enemy at the point of greatest resistance. In wound care, the sound of the guns is the call of the most difficult wounds, the most challenging patients, and the most complex situations. These are the wounds that other clinics might pass on because they're daunting and have a high risk of poor outcomes. For us, they are our mission. Instead of being deterred by their difficulty, we should be drawn to them. This isn't about a challenge. It's about a commitment to true healing. Running to these wounds means embracing the complexity and seeing an opportunity where others only see a problem. Take, for example, the chronic diabetic foot ulcer with suspected osteomyelitis. This is a common and dangerous type of gunfire. Many providers will only treat the wound superficially, applying a basic dressing and hoping for the best. Or maybe they will throw weeks of random antibiotics at the patient in the hope that something sticks. Or maybe still, they aren't even aware of the underlying osteo. A professional who runs to the sound will order an MRI or a bone scan to confirm or rule out osteomyelitis. They will perform a deep debridement to remove all devitalized tissue and ensure a clean wound bed, even if it's painful and takes time. They will involve an infectious disease specialist to manage the bone infection and a podiatrist to proper offload and surgically intervene if necessary. You aren't just treating the surface. You are tackling the core of the problem head on. Or what about the massive stage 4 sacral pressure injury? These wounds are often a result of long-term neglect and can feel overwhelming. Many would opt for simple passive dressings like wet to dry dressings, which do nothing to help a heal wound. But running to the sound of the guns means you embrace the scale of the injury. You will admit the patient to a hospital or long-term care facility for an aggressive treatment plan. You will coordinate with a dietitian to address the patient's nutritional deficiencies and a physical therapist to create a turning schedule. You will perform a surgical debridement or consider a wound vac, seeing the extensive tissue loss as an opportunity for comprehensive, decisive action, not as a reason to give up. These patients come to you because you are the specialist. These complex patients need you to run toward the sound of their guns, their wounds, their fight. That is your mission. A particularly challenging sound of the guns is the non-healing wound with multiple comorbidities, right? The patient might have poorly controlled diabetes, peripheral vascular disease, maybe kidney failure. It's easy to blame the comorbidities and claim the wounds can't heal. But running to the sound of the guns means you become the quarterback of the care team, You will coordinate with the patient's endocrinologist to optimize blood glucose levels, a vascular surgeon to assess blood flow, a nephrologist to manage the kidney disease. You treat the wound, but you also lead the charge in managing the systemic issues that are preventing it from healing. You don't see the comorbidities as a reason to quit. You see them as the challenges you were trained to tackle. In each of these scenarios, you're not just providing care, you're demonstrating true leadership. You see the difficulty not as a roadblock, but as a puzzle to be solved. You are the professional who runs towards the most difficult cases, and in doing so, you become the one who achieves the most profound victories. Now, the sound of the guns isn't always a clinical issue. Sometimes it's the patients themselves. These are the individuals who have doctor shopped, the ones with significant psychosocial challenges, or those who are outwardly hostile due to years of frustration and pain. It's a natural human response to want to distance ourselves from these difficult situations. But a true leader in wound care runs toward these challenging situations. Many so-called difficult patients are a product of a broken system and a life of hardship. They might be labeled as non-compliant because they repeatedly fail to offload or follow dressing instructions. A rigid mindset would see them as a lost cause and simply discharge them from the clinic. The run to the sound of the guns mentality, however, compels us to see them not as a problem, but as the core challenge we must solve to get them to heal. You run to the sound by digging deeper. Instead of scolding them, you take a moment to understand their reality. You ask about their living situation. Are you able to put the dressings on by yourself? Do you have someone who can help you? You explore potential mental health barriers. I can see how frustrating this must be for you. How has this wound affected your day-to-day life and your spirits? You see their difficulty not as a personal failing, but as a barrier to healing that you are uniquely equipped to help them overcome. You don't dismiss them. You commit to understanding their unique situation and finding a way to make the treatment work for them. This is where your persistence and empathy become your greatest tools. The act of running toward a difficult patient demonstrates to them that you are different. You aren't giving up on them like others have. You're showing that you see them as a person and not just a wound on a body. This approach builds trust and can be the turning point in their care. By addressing the psychological and social wounds that are often intertwined with the physical ones, you are truly running to the sound of the deepest seated problems. You're being the professional who embraces the entirety of the patient's struggle, not just the parts that are easy to treat. Now, this mantra also extends beyond the patient and their wound to the administrative and professional challenges we face every day. These are the uncomfortable, frustrating, and often bureaucratic situations that many would rather ignore. But running to the sound of these guns means you embrace them, knowing that a problem left unaddressed can jeopardize patient care. Administrative roadblocks can feel like a silent, slow-moving enemy. An insurance company denies coverage for a vital dressing. A billing issue is holding up your clinic's revenue, or a referral is stuck in a bureaucratic loop. It's easy to let these sit on your desk, assuming someone else will handle them. But this is the sound of the guns. You run toward it. You take the lead and write a detailed letter of medical necessity yourself. You pick up the phone and spend hours fighting for what your patient needs. You personally investigate why a referral hasn't been processed. This is not just a battle for your practice's bottom line. It's a battle for your patient's healing. You refuse to let administrative friction compromise the quality of care. Now, the guns can also sound when a disagreement arises with a colleague in another specialty. You might recommend a course of action that a primary care physician or another surgeon disagrees with. I've seen this a lot when I referred a patient to another surgeon for a specific procedure, which I wanted the patient to have to maximize their potential for healing. I've had several patients with challenging sacral wounds which have not responded to all the dressings in the closet and then some. A flap was the only solution in my mind. So I naturally referred the patient to a plastic surgeon. But since the patients were new to the practice and they hadn't seen all the months and years of frustrating outcomes, they started from scratch with wet to dry dressings. Instead of listening to my referral message or reading my notes about the need for a flap. Another patient had a challenging foot wound in the setting of heart failure, uncontrolled diabetes, and ongoing tobacco use. Under the care of a good podiatrist, the foot could have been salvaged. But somehow, the patient ended up with an old-school vascular surgeon instead who could only think of one thing: amputation. An unnecessary amputation and ultimately a frustrating and unnecessary result for both me and the patient. These were all painful lessons for me to learn. In some ways, it was my lack of communication, or perhaps pure communication overall, that led to undesired outcomes. We need to be able to have the necessary but uncomfortable conversations that many would rather avoid. Running to the sound of the guns means you have that conversation. You don't just send a quick note and hope for the best. You schedule the call, present your evidence and clinical rationale with confidence and clarity, and advocate for your patients. You stand up for what you know is right, even when it's professionally challenging. This takes courage, but it's essential for patient safety and for solidifying your role as the definitive expert in wound care. Don't let personal discomfort compromise your patient's best interest. So, running to the sound of the guns is about more than just courage. It's about purpose. It's a deep-seated commitment to your profession and your patients. The most fulfilling victories in wound care don't come from the easy cases. They come from the ones that challenge you, that test your resolve, and that make you a better leader and a stronger advocate. So I challenge you. Be the professional who doesn't shy away from the hard stuff. Be the one who willingly takes on the most complex cases. Be the one who runs to the sound of the guns, knowing that with every step, you are becoming a more skilled, more resilient, and more effective healer. And with all that, thank you again for joining me on WoundCasters by Wound Care today. If there are any particular topics you want to hear about or guests you would like to see on the show, reach out and contact us. If you're listening to this on a podcast app, be sure to subscribe and leave us a 5-star review so others can find this content more easily. And if you like this particular episode, please share it with a friend. As always, be sure to tune in next time as we explore yet another vital aspect of the challenging and rewarding field of chronic wound care. Ciao.